Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Welcome back, everybody. It's something that is very prevalent in our society. I believe it's even escalated since COVID. And if it's not you, pretty good chance that maybe somebody in your circles is dealing with this. I'm talking about addiction. Could be to anything. There's ways to help somebody, and you might not even consider it. One of those ways, ketamine. We're going to talk about that today. He is somebody who offers ketamine therapy and so much more. He runs very deep in terms of psychotherapy and all of that. What's that word? Psychopharmacology? I say it. Did I say it right?
Yeah, that's it.
Oh, I took a stab at that one. Dr. David Lifschutz is back with us. Welcome. How you doing today?
I'm good. It's so flattering. Thank you for the intro.
You have so many accreditations, credibility in this line of work. You've been doing it for decades. I have to be honest with you. The part I love about you and talking with you is you're fully transparent. Even your personal life, you've shared experiences with ketamine, other substances, just in your journey to learn about how they impact and how they change lives, change your life as well. Even before we got on here, you're talking about a keto diet that you're on right now, which has been on my radar. So it's like that. I think that makes you radically different. Addiction. Let's before we get into the different types and how to support that. What's going on with addiction? Why does somebody gravitate? Is it to numb what's going on in life? Is that essentially what's going on there?
It's to numb and to feel good. It's like part of its DNA.
Hmm.
I mean, part of it's yeah, it's like you know, it's like you want to boost certain chemicals in your bloodstream and in your body. So that's why people take drugs. They also take drugs because they are so wounded emotionally, and it's to get rid of the pain. And
Hmm.
it can be any kind of drug. I mean, I'm now considering sugar a drug, and people get addicted to sugar, and it's horrible for you. What it does is you know how when you roast a chicken and you put some sugar on it and it gets caramelized and it tastes so good outside. That caramelization is what happens in your body when you eat sugar. It happens in your brain. It happens to molecules. And that's why people who have been using sugar for a long time don't think as clearly. I mean, this is a gross exaggeration. I'm sure a lot of people will shoot this down, but it does affect your ability, I think, to function well. And it's really hard to stop being addicted to sugar. And I've been trying to do it for a long time, and finally I got to it a couple of years ago. And I had a hip replacement about a year ago by a really good guy, and then my other hip was acting up. And when I stopped sugar and carbohydrates, the pain went away.
Wow.
And I saw my orthopedist, who's a guy over at HSS, and he said, well, it's a good bet. Part of it is the sugar, no inflammation, because sugar causes inflammation in your body.
Yeah. Yeah.
Um, but another thing I deal with somewhat is alcoholism, which is another big addiction. And a lot of times it's because if you come from a family which has a lot of alcoholics, genetically you can be addicted to alcohol, not just based on, a lot of people get addicted to alcohol because they drink a lot and they like it, but a lot of this is genetic. So what I do, and it's interesting because I just got a new patient, an old patient of mine who came back because they had trouble drinking. And after he was able to stop it, we're treating him with ketamine. And we do ketamine sessions once a week for his depression. And it also helps his alcoholism somehow.
Wow.
One of the things ketamine does is it gives you these very extraordinary insights into yourself.
So genetically, I've loosely heard that when it comes to alcohol, but never realized it was as strong. Um, Somebody who's addicted to alcohol then takes ketamine. What's the magic that goes on there to help somebody wean them off?
I really don't know,
Wow. Hmm.
but I've had two patients long term who were really addicted to alcohol. I had one 17-year-old girl who actually she was 19, but we had her on ketamine for a year. And she had been addicted to ketamine because her family got her addicted because they didn't like drinking alone. And then finally she said, after being on, not addicted to ketamine, but taking ketamine for therapy for about 8, 9 months, she said, I'm telling my family I'm not drinking anymore. I just don't like it. I never liked it. I'm not doing this anymore. And she stopped. I had somebody else come in who was very addicted to drinking. And I sent him this friend of mine who's a doctor, who's an internist. He's from Australia. He's the guy who examined the guy who ate Big Macs for a year.
Oh,
Remember that?
yeah, yeah, yeah.
And he told this patient of mine, he said, well, if you keep doing this, you're going to die in probably a couple of months. Just like that, your blood work's off the charts. So he said, okay, I don't want to die. So I said, okay. So we did ketamine. We did like 6 ketamine sessions over a 2-week period. It was like doing 2 years of psychoanalysis. He didn't get to work through all the insights he had, to really work them and understand them in depth. But all his psychodynamics, the map of how he got to where he is, came out. And we got to see the lay of the land. And then we had work to do for another long period of time.
So let's look at that situation. Ketamine gave him clarity to better understand why he gravitated toward alcohol or for anybody, any other substance like that.
I don't think it was that clear, but it made him. Ketamine does give you clarity because when you take ketamine and after a ketamine session, you feel like this weight has been lifted off your shoulders and you feel a lot clearer. And you go, why was I worrying about all that stuff? Most of it seems it's not worth worrying about. But, and I have somebody now who I just started doing ketamine with who was drinking enormous amounts and he just couldn't stop. And he told me, he went to see somebody else and they get administered ketamine, medically, and he stopped drinking this a couple of years ago. I said, okay, we'll do it now.
Wow.
We've done 2 days now, and he just texted me. He's on something we put people on who are on naltrexone, which blocks opiate receptors, because opioid receptors are what gets you high when you drink, oddly enough.
Isn't
And
it so? I'm sorry, I didn't mean to cut you off.
go ahead. No, go ahead.
I just find it fascinating that ketamine had one purpose, anesthesia, then that it was a recreation drug, if you will. It's been connected to, date rape as
No,
well, and
right.
all of this, but then it comes back to it helps and supports people.
There's a lovely guy who's the head of psychiatry at Yale Medical School. And he thought, ketamine was like PCP. So it makes people a little like they're psychotic, like schizophrenia. So he said, maybe we could use this to mock it and then maybe we could work with it. So then they discovered this cured depression in people who didn't respond to typical antidepressants. And that's when we found out helps people who are depressed or suicidal. I have a buddy of mine, a woman psychiatrist in Connecticut, who has been doing IV ketamine for a couple of years, and she would advertise, don't go to the hospital, don't go to the ER if you're suicidal, come to the clinic. You'll avoid going to the ER. And she would give them IV ketamine, and 6 sessions over 2 weeks or less would get rid of the suicidal ideation.
Do you feel that because of the press, things that have been said, misunderstandings, and all of that surrounding ketamine, that somebody might be afraid to gravitate there because it's, yeah, I'm doing, alcohol is my thing right now. I don't want to get onto something else over here that I could be, addicted to and all of that.
Sadly, it's true
Mm,
because, what happens is, I don't know if you know this. I worked in LA I had a practice there for about 8 years. I trained in LA. But a lot of people, in show business, there's a lot of money floating around. And a lot of times people feel they're entitled to pay. If they can pay enough, they'll get whatever drug they want. And that's what happens sometimes.
mm,
And this last gentleman who ended up dying from ketamine because he got into a hot tub.
yes.
Nobody So it wasn't really done medically. It wasn't done with people who were responsible.
This is true. Matthew Perry from Friends we're referring to, and yeah, to your point, and there's some charges that are surrounding it. But I guess his housekeeper or somebody in that role was the one responsible for getting it, and somebody in a minimal role, not a medical professional, was administering it. And the last thing that Matthew said was, "Hit me up with a good one this time." He would take regular treatments at home.
Yeah, and that's not okay. But also, who prescribed it was a doctor, unfortunately. And I just don't do that.
Yeah,
And you want to make sure it's a very safe set and setting. That's why I couldn't think of this 2 sessions ago. It's the mindset you have, and the physical setting has to be calming and supportive. You don't do it where there's a swimming pool
right,
because you dissociate. And if you dissociate, you're not going to be able to get out of a swimming pool because you lose awareness of where your limbs are.
right. And it's different for everybody, in my
It's different
understanding,
for
right?
everybody, but it's very safe because if you get it medically and the doses we use are very safe. So it's not going to harm you as long as you've been screened by a doctor. I mean, there are it can raise your blood pressure intermittently, but generally, if you've been screened by a doctor, you'll be okay.
It's different. However, when somebody excessively drinks alcohol, they're getting into a certain state as well. Not the same state,
Right.
but I'm looking at a parallel here where you're taking something to get somewhere. Alcohol is going to make you feel a certain way. Ketamine is going to make you feel a certain way. Maybe it could be said that you disassociate a little bit in terms of life when you excessively drink alcohol.
Absolutely. I mean, I entertain a lot of ideas about what it's doing, and you don't always know what it's doing. It's using a totally different pathway chemically than the other antidepressants are. But we know it works. And one of the things about medicine, for years and years and years, if it works, you do it because it works. And so a lot of times, initially, in medicine, you don't understand why something works. But if it works, you'll do it because it saves lives.
Is there anything floating out there in regard to ketamine that you can honestly say, and other medical professionals can say, we don't know? Like you just said,
Yeah.
it works, but there was a few things we talked about today. We don't really have a definitive answer. Are there some of those things there surrounding ketamine?
I think a, a lot of people have been studying the chemistry of it, and they understand the chemistry, but why it makes your depression better, I don't think we quite know. I mean, we do know it does certain things like there's something called BDNF, which is brain derived nerve trophic growth factor, BDNF, brain derived neurotrophic factor, which means this chemical helps you make more synapses in your brain. And that's what ketamine promotes. And some people who feel it's all physical and it's not emotional, and they don't like to deal with feelings about this very much, and some very good clinicians feel that way. They say, well, it's because of the BDNF. It makes all these new synapses so you can explore things better, or it helps you feel better because of that. Maybe. It's probably partially true. But there are all kinds of emotional things that come up. Once I was doing ketamine in a conference with other ketamine providers, and I took a really low dose. I took 10 milligrams. And I had the amazing journey. In fact, I got into an LSD trip that I did when I was 25. And I came from a very difficult family, to say the least. It was very stressful. So this was the first time I took LSD. I cried for 8 hours. And I didn't understand it. And then, of course, years later, I understood. I was crying because I missed so much growing up, because I had a very overly controlling family, and a lot of stuff went on, and I was very sad about it.
Wow.
But
thank you for sharing that, because I believe it makes a lot of us think that, you know, some of the things that we deal with, the way we react to certain things, of course, triggers, call them that. We may not know the reason why. And with LSD, you got clarity on it. And I wonder if that also happens with ketamine.
I think it does to some extent,
Hmm.
especially with people who've been traumatized. A lot of times people will not remember the trauma, especially if it happened when they were very young, like 3, 4, 5 years old. And then it comes up in during or out of a ketamine session, and then they get to work with it.
Hmm.
I mean, sometimes if it's a small child who experienced the trauma, one of the ways, the newer ways of doing therapy is it's about your inner family, and we can have the grown-up get to know the small child part of them who experienced this and help nurture them and reassure them and say, you know, you went through this, but this is your grown-up you, and I'll take care of you. You know, so whenever that, you know, with the patient, whenever their child part, they get very grieved about something that happened to them, maybe the adult you can take care of that child part of you. You know, look in his eyes or her eyes and tell her you're there for them. And it's all called, you know, it's sort of psychodrama, but it works.
Well, through hypnotherapy, essentially, I did that.
Really?
Yes. And that was yeah, I've had stuff in my childhood. Um, I think it might have been the first time I ever did hypnotherapy, was even virtual. And I said, taking back my childhood. It's like Back to the Future. Let's go. Because as my understanding, mostly everything that we deal with in our childhood is what pilots us today. And in the session, which, got emotional, it was like watching myself on TV as a younger child. I faced myself and reassured my younger self, I'll always be there for you. I got you. Don't ever worry. And I got bullied as a kid, as a fat kid on the playground, parents divorced very young, all of that. But to your point, it was the reassurance. It was, just reparenting yourself essentially. But it kind of sounds like that's what happens with ketamine. Kind of takes you
Yeah.
back there.
I just wanted to make a point because I have studied hypnosis somewhat, and I just wanted to clarify,
Sure.
when you go under hypnosis, you're not out of control. You are giving control to someone else. But a lot of people get frightened about hypnosis.
Yes.
I just want to reassure you, you're the one who's in control because you're voluntarily, temporarily giving up control for a while.
I
Just so
look, I describe it as the hypnotist, hypnotherapist, is handing you the keys to your subconscious. You're doing all the work. They're just allowing you to get in there and realize certain things and make those connections. Um, but you have to want it to work. I know people close to me, said hypnotherapy, try it. It's good for you. Um, and it didn't work. But I think they weren't open and free enough to allow it all to work. Maybe ketamine would be a good choice for them. I don't know.
might be.
Hmm.
But again, it's also, who's the hypnotist and how skilled are they? And it works for some things, it doesn't work for others. I had a teacher of hypnosis of mine who underwent deep abdominal surgery with hypnosis as her only anesthetic, self-hypnosis. I would never do that because I don't have the skills or the courage to try to do that. But she went through, she had the deep abdominal surgery under hypnosis and came out of it and was fine.
Wow. But you bring back a memory. One of the people who I was connected with through hypnotherapy would self-hypnotize themselves and then go to the dentist and have a procedure, drilled, yeah, all of that. And that's all he did. There was no Novocaine, no.
Oh yeah, I this teacher of mine told me about she did the same thing and she said, "Well, sure because I just hypnotized myself into believing I was by the pool and I was in Florida and the drilling was the guy chopping the ice for my drink and my
Ah,
tooth with, oh, they're just making my martini or not a martini, but something with ice in it. And a whole drama that was going on with the dentist really became something by the pool, having a drink, chopping ice, stuff like that.
I never thought of it that way. What a kind of cool way to visualize it, to get your mind off of it. And I've self-hypnotized myself based on the things that I've learned. I was on a retreat, three, 4 months ago, and there was some downtime, and they said just take the time. It was pretty heavy, retreat stuff that was discussed and everything. Um, and I was like, oh, I'm gonna have my time. I'm going in. So I brought myself into that state, and it was just wonderfully relaxing. They didn't tell how much time you would have. And then the facilitator came on the microphone, and I was like, "What?" I was in such a beautiful, relaxed state of hypnosis. It's amazing how it works. But same thing with ketamine, how that can work,
Yeah,
help you realize things.
ketamine can help you realize things. I It was very funny because when I was at this seminar, I was in this seminar. There were five women who were taking the seminar with me. One of the things I had a very controlled childhood, so I wasn't allowed to think about a lot of things, and until anyway. But so one of the things that came up for me in ketamine was, as well as my LSD trip, was, oh my God, I'd never thought about this before. I said, I wonder what it would be like to have a child with each one of these women. And it wasn't a sexual thing so much as a paternalistic thing
Hmm.
that, and I'm sure kids who grow up in different kinds of families will, as you're a teenager, you think, oh, but I want to have a child with this one, with that one. And it
Hmm.
was great. And then I was telling a friend of mine who's also a psychoanalyst, my friend Gita, we were talking about getting together for coffee just to catch up after this meeting, this 3-day meeting. And she says, yeah, can I bring the kids?
I know exactly what you're talking about in that it's a pondering kind of thing.
Yeah,
If you pick, one woman and you think, yeah, again, not in a sexual way, but you're just looking at like, well, I wonder what the dynamics would be with her personality in mind, what the kids, how they might act, how they might look, and what would it be like, being in a relationship with that person and raising kids? I understand what you're saying. I totally have a
funny
crystal
thing,
clear.
the funny thing was somebody who was a body worker was in the seminar. And when I just explained where I'd been and what I'd been through. She didn't understand that it was not sexual. So she said, "We don't treat that here. You'll have to go somewhere else."
Maybe we're on the same wavelength, but I totally got you. And I could do that right now to women I know that are just friends, no other connection, just wonderful people, what it might be like, but there are some where I would think, no, like we have a friend, we call her Crazy Dawn, love her, but no, crazy. And then she's, just always changing her mind and everything. Yeah.
Right. When you think about it, that's a very healthy thing to do. If you're thinking about choosing a partner, you want to really think, would I want this one?
Yeah. Interesting.
Maybe not. Yeah.
Boy, we went off in a different direction there, but in a fascinating way. David, if somebody wants to connect with you, I know you do things virtually, ketamine treatments, of course, in the Metro New York City area. What's your website?
My website is creativehealingpsychiatry.com. And finally, I got my answering service up. So my phone number of the office is 212-529-2733, and call. And, a lot of times I have a 5 or 10 minute talk with people just as an intro talk, if they want to just talk about what it might be like to do something with.
Starts with a conversation. We had one today, learned so much and appreciate it. Thank you so much for being here.
Thank you. It's always a pleasure.
Same. We'll catch up soon. We'll be right back.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house. And there's no catch.
It'll be our very first home that we've ever owned.
This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.